Hey everybody, my name is Taylor Heath and this is my case study one. So my client is male. He is 7 years old and he was diagnosed with autism spectrum disorder. His main behavior of concern is inappropriate language. So the operational definition is going to be any instance of insulting, threatening, or aggressive language that is directed at someone or directed towards an object as well. We have noticed that he will curse. That is his main inappropriate language, is cursing. So we have noticed when he's playing, he will curse randomly. But he does, insult others, use aggressive language. I'll let you use your imagination with that. So yes. So his maintaining contingencies for positive reinforcement is just gaining the attention of the RBT. This is becoming more severe and we're not really sure why. I think because in the beginning we were telling him, oh, let's use nice words. So I think he realized, oh, I'm getting attention for this, so I'm going to keep doing it. Also escaping an activity or group of peers. This is interesting because he always asks to go play with other peers, but if there's too many peers in a room, it seems as though he will engage in inappropriate language. And we do think it's for an escape reason. We're not sure if it's just too much, overwhelming, anxiety. We're not really sure. And then also escapes from demands from an RBT. This doesn't happen as much as, trying to gain the attention or escaping activity or a group of peers. Or people in general. It doesn't have to be peers. If there's a lot of people in a group, like I said, he tends to engage in IL. So yeah, he does not engage in it as much when we're just giving demands. It's just more so the other two. So for the intervention, we did utilize a functional communication training. This is to request for a break, and we paired that with differential reinforcement of other behavior. So in the beginning of all of his sessions, he was told that if he needed a break, he needed to ask for one and it would immediately be given. We did engage in behavior skills training, so we could utilize modeling for asking for a break and letting him practice this with us. So the client was also told if he used nice words for 10 minutes straight, he would be able to have access to his preferred reinforcer for 10 minutes, and that preferred reinforcer is his iPad. Most of the time, I would say 95% of the time. This was faded eventually to every 30 minutes if he did not engage in inappropriate language and he still received his iPad or whatever he chose that day for 5 minutes. So his motivating operations, a preference assessment was conducted during every session, which allowed him to choose what he can receive for not engaging in his IL. There was one time where we did decide to not ask him for, or not engage in the preference assessment, and his inappropriate language was increased. So that was really interesting. Like I said, if he does not have anything motivating, his IL is going to be increased. NCR was also utilized throughout the session. So this gave him the attention that he was seeking, just in an appropriate way. So we would praise him if he was playing with peers, using nice words, just really anything other than him engaging in that IL. He really enjoys squeezes as well, any kind of squeezes, hugs, etc. And it has shown to reduce the amount of IL as well. So his schedule of reinforcement, so his NCR was implemented on a VI3 schedule. So about every 3-ish minutes, his non-contingent reinforcement was given. And for his DRO, this was a VR10. So if he engaged in his IL before the 10 minutes was up, the timer did restart. And he knew that. So he caught on pretty quickly because it started to be a longer time span of when he did engage in that latency. So for his generalization and maintenance, so he has multiple therapists throughout the week. I would say it depends on a given week, but 3 to 5. this is also generalized at home, in public, as well as in his school setting with his accommodations and his BIP. So the teachers and staff all knew that this was going on, that this was the interventions that we were utilizing in his clinic, and they were utilizing that in the school setting as well. So data was also collected by all of his therapists, his teachers, and his parents to kind of give us a gauge of how this is going. Is the intervention working? When behavior falls within his master criteria, it will only be tracked twice a month. And this is just because it's not going to be necessary to track something that's not happening. So his outcome, after 1 week, his frequency of IL went from 26 on average a day to 10 a day, which was fantastic. There was times where he was having 40, 50. I mean, it was crazy, but on average, after I had did my research and got all of his data, it was 26. After 2 weeks, the frequency dropped to sometimes 0 a day, but average 2 a day, which we will take. That is absolutely fantastic. So he also had precursors that he engaged in that began to decrease as well. This included screaming with a high-pitched tone, fidgeting, sometimes, messing with papers, light property destruction, and that showed to decrease as well, which is great. So thank you everybody for listening to my case study 1.